Welcome to Good Gut Live. This is an extra special Good Gut Live because we have a very special guest, Dr. Micah Yu. We're going to be getting into it. For those listening live, you know the benefit of listening live is we can see your comments down below. We will take time to answer some of these questions and comments down below. So that is the benefit of watching Good Gut Live. For those listening later, thank you so much for listening and watching on the Good Gut Live podcast. I'm going to let Dr. Yu, because Dr. Yu does so many things. He's now certified, and so I can't even keep up with all the certifications. We're going to get into that. Our topic today is really connecting gut health and autoimmune issues. I don't know about you all, and for those listening, but I know so many people with autoimmune issues, and it seems to be on the rise. So we're going to get into all that, the connections with gut health. But first and foremost, Dr. Yu, give us your intro and update us. Are you now octuple board certified? No, I'm just kidding. But go for it.
Well, thank you for having me on the show. First of all, for those of you who don't know, James and Dahlia are great friends of mine, and I'm so privileged and honored to be on here talking to them both. They're really great at what they do. I don't know if I can even remember my certification. So so I'm Dr. Micah Yu. I'm a board certified integrative rheumatologist. So I'm board certified in internal medicine, rheumatology, integrative medicine, and I'm certified in lifestyle medicine and functional medicine as well. I have my own private practice. That's it for now. I might die before I finish all the things I want to do. But what else is there? I'm a practicing rheumatologist in Newport Beach, California. And I'm also a member of different societies. I'm part of the American Academy of Environmental Medicine, International Society of Environmental Acquired Illnesses, ICI. I'm also a member of the International Lyme Disease Society as well. I'm a part of groups that investigate chronic illnesses and why patients have chronic illnesses. I myself, for those of you that know, I have my own chronic illness with autoimmune arthritis, specifically spondyloarthritis. So I got better myself by eating a plant-based diet. So since that worked for me and then no one really taught me in the medical field how to do that, I've been on a mission and a journey to investigate how patients can get better naturally and why patients get these chronic illnesses. That's where I am today. That's what's up in my life.
That's it. Nothing much. Not too much.
And then I know we're also on your channel a bit. So just for those that don't know, my name is James Marin. I'm an integrative registered dietitian, environmental nutritionist.
I'm Dahlia Marin. I'm an integrative dietitian, certified gastrointestinal nutritionist, and we are both part of Married to Health, which is a practice of dietitians seeking to help those who need it to heal with each meal. So that's our Northern Star.
And we're connected in this integrative nature. And that's really why we're friends and also just colleagues professionally, because we understand the importance of being integrative. And I think that's why so many people resonate, whether it's on social media or our patients or, whatever the case is because we're not just here to be like, yeah, oh, you're dealing with this, just live with it forever, right? Oh, hey Micah, you're feeling all these inflammatory autoimmune issues. Yeah, that's going to be your life forever. So what was that for you? Like, how did you become integrative or find this path? Like, where did that begin?
Yeah, I mean, it really began with my illness because when I got my arthritis diagnosis, which took many, many years, luckily I was diagnosed before, things got even worse. So I was in a lot of pain for many years. And I got diagnosed with my arthritis, and then they told me you got to go on these medications. Well, I'm a bad patient. I don't want to go on them. So I suffered. I would flare every month with these pains. And then luckily, I fell upon whole food plant-based nutrition. I tried it out. Within 2 months, I got better. So that sparked my curiosity. Why weren't we taught about nutrition in medical school and residency and fellowship? And what else is out there that I'm missing? So that led me to different rabbit holes in integrative medicine. So there's so many little rabbit holes you can go down in integrative medicine. So I learned about nutrition through my integrative medicine training and functional medicine training. And so now I'm learning about Lyme disease, Bartonella, mold, and all these toxins out there. And what can I do for these patients? Because you don't give patients medications all the time for these. You have to give herbal supplements, homeopathic treatments, different things in combination of medications to get patients better. So that really led me to this hunger to keep learning to help patients.
And, I know this from sharing so many patients with you that they just so appreciate your tenacity for learning because, yes, you have dealt with spondyloarthritis, but you've never dealt personally with Lyme and Bartonella and all these things, but you see the need and you see that just putting people on immune suppressants is not helping with those underlying issues. Sure, it may dampen the symptoms and help them have better quality of life, but they're not having that whole health they're looking for. So I know that just from sharing patients with you that they're so grateful that you have this passion and this desire to learn things because you don't have to. You could just not have done all the work that you've done, acquired 5 board certifications and kind of just been like, well, I'm just going to, live peacefully and work in the regular system and model and just prescribe these immune suppressants and the rest of the stuff others can deal with. What really made you want to be that person for people to say, I do want to help you. I can relate in some ways, but even in the ways that I can't, I do want to be that person for you.
Right. Thank you so much, Dahlia. Well, I want to say the same thing about you. My patients are so grateful for you when I refer them to you for SIBO or other autoimmune issues. They're like, "Oh my gosh, I got fixed," and thank you for just taking and
Yay.
you and your team for taking good care of my patients. So what really got me motivated to go down this rabbit hole is that I really empathize with my patients when I see them in this chronic pain or they've seen 10 to 20 doctors, literally 20,
Mm,
10 to 20 doctors. Then I'm like one of the last resorts. And they come to me saying, oh, everyone's saying it's in my head. I've been referred to neurology, rheumatology, endocrinology. No one can help me. And they see naturopaths do. I'm like, well, I'm probably one of your last stops if you've seen all these doctors and great practitioners. No one can help you. So that's what really got me motivated to keep learning about this stuff because my field is all about chronic illnesses,
mm,
rheumatology, and these patients get very, very sick. And my field, there's a lot of symptoms that overlap with other conditions. Mast cell activation syndrome, you get rashes, you get joint pain, GI issues. Well, we don't learn about that in rheumatology. So, like,
mm,
when I see these patients, I'm like, it sounds like mast cell, but I don't know much about it. I went learning,
mm,
I went to conferences, I read books on it, and now I'm very comfortable treating mast cell activation syndrome. And then I learned about mold. I'm like, I gotta learn everything about mold. So I went to learn from Neil Nathan, Jill Krista. I'm part of their group. I go to their quarterly lectures. So they're one of my mentors. They might not know who I
amazing.
am because I'm in a big group. They don't know who I face is, but I consider them my mentors. And then I noticed that, listen, I learned about mast cell. I learned about mold, but then these patients still have something missing. I'm
Mm,
getting these patients better, but there's still a subset that come to me with these problems. So I wanted to learn about Lyme. So it's never ending journey. It's continue learning. And that's what really drives me because I want to see these patients better. And I feel really bad for these patients sometimes. I'm literally their last hope.
mhm,
Some of these patients tell me, if you can't help me, I think I'm done. I'm like,
mm.
well, there's so much life to live. And I want these patients to be productive in society and to give back because if they can help them, they can help so many other people in the world.
Yeah.
You said something really cool, and we can definitely like resonate with that. Is this like almost like scope of symptoms, right? And I think in our education, even as dietitians or as doctors, we get like siloed into like these are the symptoms for your patients, these are the symptoms for your specialty. But when
Mm,
you realize like eczema and like you're saying, like even um like flakiness of the scalp and like
dandruff.
dryness
Mhm.
and so all these things, what would you say are when you start to speak to some patients, like what are the most common, like, oh my gosh, I didn't know that was related to my, or would you say you have an idea of like some of those symptoms where your patients are blown away? We're like, I didn't even know that was
No one's ever
related.
mentioned that to me
Like no
or
one's ever said or connected those dots of this, the way I feel with this, and oh, that's a root cause for that.
Yeah, yeah, definitely. For example, this is something I learned recently because the patient was referred to me by another rheumatologist for joint pain that didn't fit any picture.
mm,
And this is a patient I referred to you guys. And this patient, I was like, you might have SIBO going on.
mm,
So you and we both treated the SIBO and her joint pains got better. And that was the
mm,
first time I've ever seen joint pain with SIBO. Um, and mold, for example, I've seen patients with brain fog, fatigue, GI issues, joint pain. And we never learn about mold in medicine. They think it's crazy medicine, woo woo.
mhm,
But I ignore these people because they don't educate themselves on it. And lo and behold, you treat them and they start getting better. They feel better. Um, Lyme disease as well. There's acute pain we can get from Lyme disease, but no one thinks about these long-standing issues with Lyme
mhm,
disease. And you can have Lyme, Bartonella that lasts for years that needs to be treated properly, or else they're going to have persistent brain fog, fatigue. They can't even get out of bed. And these patients, they need help.
mhm.
And you can only help them through the integrative way.
Yeah, because so often they do receive that experience where their other practitioners are kind of throwing their hands up and they're like, well, I used my 5 tools that I'm used to using. None of them worked on you. I can't help you anymore. And we know there are so many people out there. And, we know we've both worked in kind of the traditional Western model in our early days and kind of understand why it is. Like, I totally get it. I don't blame practitioners for it. They're limited in tools they can offer, especially if you're working in a larger system or there's a lot of liability in it. They fear what they don't know. So I get it. We just kind of have both chosen to say, well, I don't want to practice that way. I don't want to be that other person who's just throwing my hands up and saying, well, I can't help you. I don't want to learn anymore, or I'm afraid to learn more and explore these other areas. So it's
Yeah.
so important that you've had that passion to be that hope for people because so often we both, I'm sure, hear from patients, thank you for keeping the hope for me because I have lost it myself. And I've been hopeless with so many other practitioners. So it's just so important to even just validate someone with what they're experiencing and not tell them, oh, it's in your head and, you're on your own. It's holding that space for them and really affirming what they're going through. I'm hearing you. I'm hearing these symptoms you're saying, and let's figure it out together. If I don't have the answer right now, we're going to find the answer together.
Right. And it's I think both of us have taken the harder road. You guys
Yeah.
did not just become registered dietitians and work in the system. You guys have established your own business and really gone down the integrative path. And I didn't. I decided not to do regular rheumatology, work in the system as well. And it's hard. It's never-ending learning, and it takes a lot of energy to do this day in, day out. Because you got to learn, you got to work on your business, and then you got to treat also.
Yeah.
Totally. Oh yeah. And that's where I want to but it's this beautiful passion. I want to kind of almost talk to both of you because there was you mentioned something, Dr. Yu, where it was like, yeah, like, oh, I had this joint pain and once I took care of my SIBO or like I realized I had SIBO and like, oh, my gut issues. And so like for an average person out there, I think you both and all of us, with our practices came to this realization like the average or so many of our even let's just bring it even closer like friends and family members and people in our communities or in our church or we all know someone who's struggling with like a GI issue or diabetes or even joint pain or lupus or MS, so all of this. So it's like someone coming in going like my stomach chronically hurts or I haven't used the restroom properly in 20 years or I can't even go on a walk with my kids or jog like I used to because my joints hurt so bad. Like, what is, I guess, like what is that connection maybe, whether it's in theory or something you're coming across? Because I know as a provider, I can say, honestly, those providers who have no idea, they're not keeping up to date with the research. So for kind of both of you, what is that connection of like this gut autoimmune or why would SIBO, and we can even say what is SIBO, maybe for those who don't know, why would SIBO cause joint pain? That's kind of like for both of you. And
Yeah, I'd love
um,
to hear from Dr. Yu of
yeah.
just the science behind that cascade because it does seem like you mentioned, eating a plant-based diet worked for you. So we can get into after that
Oh
why
yeah,
some
that's a
people
good one.
maybe couldn't tolerate that. But I'd love to hear just what gets triggered in the immune system to then elicit this autoimmune response.
Yes, that's a great question. And I don't know if the science has been fully mapped out yet, but we know the gut, I'm sure you guys talk about all the time, the gut microbiome, there's good gut bugs and bad gut bugs. And in SIBO, you have bacterial overgrowth, there's gut dysbiosis, meaning the bad gut bugs are overwhelming the good gut bugs. And we know there's a gut immune system connection, a gut
Mhm.
joint connection as well. So when there's gut dysbiosis, different things can get triggered in the immune system. And I think that's why you see that joint pain come out in SIBO patients, just like you do in rheumatoid arthritis and other autoimmune conditions. But we know that SIBO is not an autoimmune condition, but there is that immune connection to the gut. So it may not be a main symptom that you see day in, day out, but for the outlier patient, that out of the box patient, joint pain can happen. And we saw that in our own patient, which
Mhm.
was surprising for me. Maybe not surprising for you, but as rheumatologists, we typically don't treat SIBO, but I've treated a lot of different conditions that are not related to rheumatology in our practice. And that was the
Mhm.
first time that I've seen joint pain resolve with SIBO treatment.
Mhm.
Wow.
Absolutely. And yeah, we see it so frequently because there are so many nerves in and around the gut. Secondary to the brainstem, the gut is one of the most innervated portions of our body. And so you're more sensitive to changes in your gut, especially females. And, I think females comprise a majority of the medical system. We're a majority of consumers because our hormones truly do make us more sensitive to these different changes. So a female is probably going to be a lot more proactive in seeking care because it's a lot more uncomfortable when your nerves are so much more sensitive. But yeah, when those nerves are picking up on those inflammatory signals, and it's not just inside of the gut, in the lumen of the gut, now it's getting out into the bloodstream and it's eliciting more of those inflammatory signals within the wider immune system, then you're saying, okay, I do need to seek help. Before my bloat was manageable, before a little bit of joint pain was manageable. But now, if it's getting to this place where I have this exaggerated small intestinal microbial overgrowth, whether it's hydrogen, methane, hydrogen sulfide, whatever it is, fungal overgrowth, to the point where I can't wear the same clothes in the morning as I'm wearing at night because they no longer fit me. My joint pain is so severe, I can't exercise, I can't regularly perform my activities in the day, then we're seeking out that information. And yeah, that's where you and I kind of cross over with it because I think both of us are such proponents for eating more plants, eating a high antioxidant diet, eating a plant-based, plant-forward, plant predominant diet. But then we do often have those people who are like, that sounds nice. I want to, but I cannot digest it. How often are you running into that in your practice with making dietary recommendations to patients and then being like, I wish?
Yeah, great question. So I make dietary recommendations to all my patients, but there are a lot of patients with food sensitivities where they can't tolerate a plant predominant diet for whatever reason. Their gut is really dysbiosed and they have to sometimes eat more meat than usual just to get by. And that's okay because they're at that current time, their gut just isn't ready. And you and I know that eating plants is one of the most healthiest things you can do for your body with the fiber and the phytonutrients. But every patient's different. The patients have food sensitivities, food allergies, and the gut dysbiosis just doesn't allow them to get to the point where we want them to be. Maybe they will in 2 years, 3 years, but it takes time. And everyone has a different gut microbiome to begin with. Everyone has different genetics. So it really varies. And when the immune system gets triggered, it can cause so many different issues. And the main goal is to make patients comfortable and feel better at that moment, and then slowly transition them over time to whatever diet they feel most comfortable with. And if they want to go with the science, then it's a more plant-friendly diet.
No, Micah, I don't have time. I need to feel better yesterday, so I'm gonna go carnivore today because that makes me feel better. How do you guys feel that we're hearing that? We're hearing the plant hate, right? Where it's like, and I don't think either of us are saying everyone has to eat just 100% plants. So we can get into that, and I want to hear more about that definitely from you,
Yeah.
Dr. Yu. And like, but yeah, but speak to that. I mean, do you get these patients that are like, I went carnivore and I feel great and I'm fixed, I'm solved, right? Would you agree with that?
Yeah, so I would say the patient's gut probably isn't tolerating the plants, and
Right.
that's why they have to go carnivore, because there's just so much gut dysbiosis. And when they go carnivore, they're avoiding a lot of the grains that could be causing problems, nightshades, lectins. All these could be potential problems for patients. And even though broccoli and spinach is healthy, maybe their gut is actually reacting to those healthy foods, so they have to go carnivore. Listen, meat has vitamins. There's great things about meat, but you need fiber and you need phytonutrients to have a healthy gut. So there are patients, and I believe them, that they do better on a carnivore diet. But is that sustainable long term? Probably not. Short term, they will feel better, but long term, there could be a lot of ramifications. We don't have long term studies on carnivore diets. There are some studies on keto. I saw a study last year that the keto diet, I think, might have been in mice, but the keto diet was able to lower interleukin 17 levels in patients. And for those of the audience that aren't immunology experts, which most of us aren't, interleukin 17 is something called a cytokine. And the cytokine it can go up, it can go down in the immune system. And when you have inflammation, your inflammatory cytokines go up. So interleukin 17 is an inflammatory cytokine. You want the inflammatory cytokines to go down. So in this study, it showed that the keto diet was able to lower the IL-17 in the mice. Now, maybe that's why some of these patients, they do better on a carnivore diet sometimes, because some of the inflammatory cytokines go down because maybe they're in ketosis. They're not eating grains, no carbohydrates. And we know that when patients fast and they're in ketosis, they will have potentially less inflammation overall, especially with fasting, like water fasting, for example. You're in ketosis, you have less inflammation. The protein called mTOR goes down, which lowers an inflammatory molecule called NF kappa beta, which will lead to less inflammation. That's why when you fast, you have less pain and less inflammation overall, potentially. That's why I love water fasting myself when I have joint pain. So that we can apply the same thinking, very similar for the keto and carnivore diet as well.
For those of you that don't know, Dahlia was our first patient. She struggled with SIBO and IBS and so many GI problems on a day-to-day basis, hunched over, causing so many other issues. We wish we had a protocol in place, a program in place that led her through step by step, inch by inch, and really guide by guide, so she had everything at her fingertips. Now we have that. That is our Good Gut SIBO IBS program. You can do it 100% plant-based. You can customize it, but it is one of the only programs that is geared towards plants, that can help you customize plants, that can help you tolerate more plants, and really gets to the root of your SIBO, of your IBS, of your ISO, SIFO, IMO, and any other type of overgrowth.
And yeah, I would say I agree that short term, I think it can be very helpful. And I think us understanding kind of the gut microbiome and not just the balance of the bugs that live in the gut between those who elicit more inflammation, those who are anti-inflammatory, but also the gut barrier. Those two components really speak to how well somebody can not only just eat, but digest and absorb some of these nutrients. Because we hear from a lot of people, you don't need fiber, we can't digest fiber. And that is true. We as humans cannot readily digest and absorb fiber. The fiber is more for the gut bugs. And so if you have a heavily fractured microbiome, your bugs are completely off, it's a very inflammatory environment, it's a very leaky environment, the barrier is excessively leaky. Sure, you might not have the bugs in place to break down and digest that fiber for you. Same with antioxidants. So, in the interim, somebody might feel better off of those things. And in the interim, might decrease some of those inflammatory markers. But we do know long term, those things are very conducive to a very well balanced microbiome that has great motility, that has a great barrier. Because long term, if we starve out those anti inflammatory bugs, they will eat away first at the mucosal barrier that helps to kind of protect the gut lining, the gut skin, and then eventually they can kind of just die off if their populations have no food. So, agreed. I think there are many different modalities to achieve that short term. And then in the long run, we do know some level of plants is necessary to keep the homeostasis, whether it's between the bugs, between the barrier. And that's why we're even seeing even forerunners in the carnivore space or in the keto space who are like, I'm eating fruit, I'm eating honey, now I'm eating some vegetables again, because long term, we're seeing that it's not sustainable for the gut bugs to go without their fuel source and they're going to die off. And then that's going to lead to more issues.
Well, I know we saw that viral clip or the meme. I know in the wellness space it was going around of Joe Saladino, the animal-based diet. He made animal-based pasta and it's spaghetti squash, and it's like I think we used to call that plant-based, right? But it's like it's now animal-based, but now we're seeing more plants go into this animal-based lifestyle. So it's funny to what you're saying, to what you're both saying. And then yeah,
and we get it. Like short term, these things are helpful,
Yeah.
definitely. So somebody's asking about water fasting, and they're saying, I would love to know more about water fasting. What are your recommendations when it comes to when water fasting is appropriate, how long, medical supervision or not, or what is your experience with water fasting?
Yeah, personally, I like to water fast. The longest I've done is 36 hours. And water fasting is not approved for everyone. So if you have type 1 diabetes, you might not want to water fast because you don't want to go in ketosis. If you have type 1 diabetes, you can go into the ICU if that's the case.
Yeah.
So it's not everyone. You definitely need to ask your doctor if it's appropriate to fast, first of all. But water fasting can be very useful, and there's so many ways to do it. You can do 12 hours on, 12 hours off, where you eat for 12 hours and then you just drink water for 12 hours, or you can do 16/8, where you will eat for 8 hours and then fast for 16 hours, or you can do multiple days. And there's fasting centers in the US where you are supervised and you can fast 1 week, 2 weeks, or 3 weeks if you want. But you need to do that under supervision because you can pass out from having a really low blood sugar. So the benefit of water fasting is that you're not eating. So when you're not eating, you go into ketosis, which can be anti-inflammatory, and it can really bring down some of these symptoms that patients are experiencing, like joint pain, fatigue, rashes, all these inflammatory symptoms that come out. Even some patients with cancer will water fast because you're sort of not feeding those cancer cells. So some people with cancers will go to fasting centers to fast for multiple weeks at a time. So there's multiple ways of fasting. That's why you can do intermittent fasting. If you don't want to do 24 hours, you can do intermittent fasting, which is relatively safe, 12 hours on, 12 hours off. So there's no one rule to it.
And from a dietitian lens, yeah, this idea of like fasting, they're all like it's this big umbrella term, right? Like fasting, and there's kind of like these little subcategories. And one, I think that is low hanging fruit for so many out there is time restricted feeding, which we call sleep, right? And I think there's unfortunately in the American population, the last 50 to 60 years, it's like, oh, we don't really sleep as much as we used to. Or it's like, I remember even Taco Bell had a commercial called Fourth Meal. It's like you eat at midnight and you get your fourth meal at midnight. And this kind of like, I don't know what you want to call it, societal, I don't know, acceptance or just kind of addiction to food, even just kind of this
Binge
processed
eating.
food that you're binge eating or stressed about as you're staying up late on your screen eating food, you don't realize, oh, I'm missing out on my fast. And that is huge. That is massive. So how many people are kind of literally doing the opposite of what you're saying? They're eating for 16 hours or 20 hours and like fasting for 4 hours when it comes to a 24-hour period. And then you're missing out on all the benefits you just said from ketosis, from I know Dahlia always speaks on the migrating motor complex and all
Supporting
the
motility and
benefits,
cleanup of
right?
the gut. Yeah.
Yeah, and it's like your body needs a rest. It's like as if you were working for 16 or 20 hours a day and only got to rest and sleep for 4, you would get burnout, right? And so kind of the same is true for your microbiome, your gut, your nervous system,
Your organs.
organs. And
Yeah.
so it's that low-hanging fruit. And then definitely like water fast is kind of the next level. And typically, I mean, I know we hear about water fasting from people, yeah, with other comorbidities or like, yeah, I have RA and I have these other issues. Let me try kind of this next step and experiment. And then, yeah, that medical supervision and consulting. And this is definitely not medical advice to water fast. Consult with your care team and definitely look into it, do your due diligence. And it can be very powerful and beneficial. But I always, yeah, I want to bring it back to that low hanging fruit of like, make sure you're sleeping enough and therefore you're fasting enough. And that's so powerful and important. So,
Get that, 12+ hour time restricted feed in the day if you can.
yeah.
That is just a low hanging fruit. I think a majority of people really could do, unless you have a specific condition. But I don't think enough people are doing that 12 to 14 hours a day of not eating,
Yeah.
and then not grazing all day as well. Really just having your solid meals, allowing even a mini fast in between the meals of 2 to 4 hours. So that, again, you're giving another little break. You give some work to your body, your bugs, your organs, and then you're giving them a little bit of a break in between, just like we all need in our work days. We take, whether it's 15-minute breaks, a lunch break, a lunch hour, nobody's expecting you to just nonstop process things and work.
Right. We're so spoiled in our modern society because we have everything already pre-made in bags already. So it's easy to eat 24 hours a day, every minute. But when you think about our ancestors, they couldn't eat. There wasn't enough food and they have to hunt for the food. So they had natural fasting already. So we need to try to maintain and control ourselves to stop eating past a certain hour and give that time for our bodies to rest. Because when we sleep, when we don't eat, it's a way for our body to get rid of the debris and all the junk that we've accumulated over time.
And we're seeing, because we're live, we're seeing from some of our channels, someone's going, "What's this doctor's name?" This is Dr. Micah Yu. This is a good way to say it. You can find him at My Autoimmune MD. right? And that's yes. And so yes, Dr. Micah Yu. So that's a good question someone
Mhm.
asked. Okay.
So we're talking about the balance of bugs, we're talking about the immune system and how it gets involved based on what you're eating versus not eating. We're talking about periods of not eating and fasting. I think one of the things that more people want to understand more about is leaky gut, right? For a while, we've been hearing about leaky gut. We've been hearing certain practitioners say that's not a real thing. Now it's more validated, but you're not allowed to call it that. You have to call it intestinal hyperpermeability. Can you speak a little bit more on this concept of leaky gut or intestinal hyperpermeability and how that is often something that those with autoimmune are dealing with without even really knowing or recognizing it?
Yeah, so leaky gut, or also known as increased intestinal permeability, is something that's being more widely accepted now. We've have literature on it in rheumatology with autoimmune diseases. So when you go to a rheumatology conference, they do talk about that, or at least they mention it.
Yay.
And yeah, it's becoming more modern now. We're finally catching up to speed in traditional medicine. But so your gut has good gut bugs and bad gut bugs. So that's your gut microbiome, and your immune system is separated from your gut lumen, where all the food travels through. It's just separated by one cell layer,
Mm,
and that one cell layer is very tight. It's not supposed to be leaky, so it's very tight, and it's sticky. It sticks together through something called tight junction. So all the cells are glued together in one layer. When you have gut dysbiosis, or you have, which is the bad gut bugs overwhelming the good gut bugs, you can have a leaky gut, and when that happens, your barrier, the tight barrier of all the cells, opens up. So undigested food particles, viruses, bacteria, things aren't supposed to really interact with your immune system, start interacting with it, and it can interact it with it in a very detrimental way, which can cause inflammation. And because you have something called Peyer's patches next to your gut lumen, and Peyer's patches is the first part of your immune system that is next to the gut, and that's where it interacts with the immune system, and that's where the immune system interacts with the rest of the body.
mm,
So when you have inflammation, it will lead to the leaky gut, and then that's where these reactions that you don't want, inflammation, can happen.
mm,
And a lot of people think that, oh, I'm taking medication. So for example, if I have RA, I have rheumatoid arthritis, I have a leaky gut. Okay, all autoimmune conditions have leaky gut. Even
mm,
non-autoimmune conditions like diabetes, high
mm,
blood pressure can have leaky gut as well. But let's talk about autoimmune focus for here. For example, rheumatoid arthritis. If you have a leaky gut, people think that if I take medications, it will make my leaky gut worse. That's not the case
mm,
if you look at the literature, because we don't know what's driving that leaky gut. Did the leaky gut come first and then drive the inflammation, or is the
mm,
inflammation driving the leaky gut, and it's a vicious cycle? So some of these medications, literature has shown that when you give some the biologics or even medications like methotrexate, when you calm down that inflammation, it actually resolves the gut dysbiosis and eventually help the leaky gut.
mm.
So not all medications are bad. It can have side effects, but it can be useful at least to control the initial symptoms and then try to taper off the medications over time, because no one wants to be on lifelong medications. So that's where the integrative way comes in, that things that you do, things that I do in our clinic.
Yes. And it's so important to marry those two to say, this is a great tool and a resource. This medication can really quelch the inflammation. And so can turmeric and ginger. And they don't need to be mutually exclusive. We can use them and really have a synergistic effect so that they're supporting one another and really acting like a fire extinguisher, reducing some of that inflammation. And like you said, maybe there are inflammatory microbes, inflammatory gut bugs in there that are also little, pyromaniacs and causing some of this inflammation and this little fire. Maybe we need to get rid of them and really evict them from the gut or heavily reduce their population in the gut. So that way they're reducing the fire that they're contributing to that inflammation while these medications act like fire extinguishers and firemen and really help to put it out and calm everything down. So I
Right.
think it's so important to really speak to that misconception that you're either Western or you're a completely holistic practitioner and you're only going to heal leaky gut if you go a completely holistic way, or, you're never going to heal leaky gut if you go the Western way. That's where integrative health and integrative nutrition and integrative medicine are bringing both worlds together and bringing the strongest tools that we have and the strongest evidence that we have from both sides together. But yes, I agree. I think we're in this epidemic of leaky gut because we're not eating the foods, first of all, that protect that one cell layer thick gut barrier, right? People think of the gut, and I think they think it's a solid organ like the liver or the heart, right? They think of these muscular, solid, dense organs, and they're like, yeah, my gut. I've heard of people having a gut of steel. The gut must be like that. No, no, no. It's that skin is thinner than our external skin as well. And so we aren't really eating enough of those foods that feed into that mucus barrier that we have. Because, we have this beautiful layer of mucus that lines our entire GI tract and many other places in our body as well. But there are foods that contain a compound called mucilage that are these gooey foods that can help to protect and bolster that protective barrier. So things like chia and flax and okra and aloe vera,
Mm-hmm.
we're really not eating. And so our mucus barrier is thin. Also, the inflammation will kind of wear that mucus barrier down. And sometimes people even see it. They're like, oh, yeah, it looks like there's boogers in my stool. That's your mucus barrier that you're passing. But yes, I love that explanation that you gave of that breakdown of those tight junctions and that gut barrier. That's supposed to be very selectively permeable. But then it's just kind of like, all right, the bouncers are out of commission and everyone just come in and out and do whatever you need to do.
Right. And then not only does food affect the gut barrier, but so does stress, environmental toxins,
Mhm.
mold, lack of sleep, uh, aging, inflammation, also
Mm.
lack of exercise. So it's not just food. Everyone talks about food, but I know you guys know this
Mhm.
too. But stress can give you a leaky gut. There's so many variables to this, and not only do we think about bacteria, but we have to think about yeast overgrowth, candida overgrowth. So many other factors contribute to this as well.
So many different
It
microbes.
sounds like the American lifestyle. Like everything, it's like
Right.
lack of exercise, lack of sleep, stress, and antibiotics, and mold, and
Pollution,
it's
glyphosate.
crazy. It's
Yeah.
crazy. But
Mhm.
I wanna go on with something you said where it's like all autoimmune patients have leaky gut. You are confident with that.
Oh
You
yeah.
back up that statement.
Oh
That's
yeah, for sure. So there's so many practitioners out there, especially in the functional medicine space, that test for leaky gut. To me, I don't test for leaky gut. For me, there's no point. What am I going to do with that information? I know the patient has some sort of leaky gut already. So if you look at the literature, even disease like vasculitis, for example, which is inflammation of the vessel, these patients are very, very sick. So they have
Mm.
bleeding noses, coughing up blood. They have leaky gut. There are a lot of diseases that don't have any GI symptoms that have leaky gut. Um, so I'm very confident that if you look at multiple sclerosis, anyone that's listening can just type it in the scientific literature, multiple sclerosis and gut microbiome, you'll see leaky gut. Lupus, you'll see leaky gut. So it's not isolated to just one or two diseases. It's everywhere.
and
Mhm.
yes, amen, dude. That is like, I mean, preach, because like you're preaching to the choir, but it's so important to hear that coming from an expert like you, because so
Yes.
many doctors out there, so many rheumatologists are just don't get this connection. But
And I want to bring it back to something you mentioned earlier with the mast cells, right? You
mm,
were talking about different involvements of the immune system. So I'd love for you to speak a little bit on the mast cells and histamines and that connection with
mm,
leaky gut, because we do have a lot of questions on it. People
yeah,
are saying, every time I eat, my throat, lips, and chest become inflamed, allergies come back. I have a poor response to supplements. Can you speak to that connection between gut imbalance, leaky gut, and then the mast cells and the histamines and other immune chemicals that those mast cells are releasing?
Yeah, so the mast cells are part of your allergic immune system. So in rheumatology, I deal with overactive autoimmune diseases. So your immune system is on overdrive. Well, mast cells is another part of the immune system that has to do with allergies. And your mast cells can release these chemicals like histamine out that can cause leaky gut, but you need them sometimes to help with their allergies. So they're an important part of your immune system. But patients with overactive mast cells, it's becomes an issue because you do want your mast cells to work.
Mhm.
But with diseases like or syndromes like mast cell activation syndrome, the mast cells are just on overdrive. It's like mast cells on ADHD. They are just reacting to all these different things out there. They're reacting to their environmental toxins. Reacting to perfumes, foods that you shouldn't react to. They're reacting to high histamine foods, leftovers, and
Mhm.
patients can get very fatigued. Patients can even react to a change in the barometric pressure. So patients
Mhm.
that fly in airplanes, they will flare with their mast cells. And mast cell activation syndrome, you can have leaky gut as well. And these patients have symptoms that can overlap with a lot of other diseases like rheumatology diseases, lupus, small intestinal bacterial growth, or SIBO. So these patients can have head to toe symptoms such as brain fog, fatigue, chest pain, rashes, joint pain, constipation, diarrhea, even pelvic pain, like or even having problems with the bladder as well. That can be part of a mast cell. And when I'm gonna go on tangents here because I love talking about mast cell activation syndrome because I
Same.
see it in my clinic. When you have mast cell activation syndrome, you clinicians need to look for dysautonomia, which is patients that have an autonomic nervous system that is out of control. So patients are having
Mhm.
a uh, very fast heart rate all the time. Patients, I look for also hypermobility, Ehlers-Danlos. So there's a trifecta when you have mast cell activation syndrome. You're supposed to look for hypermobility and POTS or dysautonomia because there is a synergy between them. We don't know why right now, but they're connected. So I see these patients a lot in my clinic. So it's very hard, but it's treatable when you have mast cell activation syndrome.
Yes, absolutely. And I think I love that. I love that you really gave that kind of progression. And some people will reach that point where it is that aggressive mast cell activation where the mast cells are overactive. And then a step before that can be just histamine intolerance, where maybe the mast cells aren't outputting so much histamine, but because of intestinal hyperpermeability, because of gut dysbiosis, there's more histamine than they can break down. So maybe it's an appropriate amount of histamine, but they just struggle to break it down. The systems in place that are meant to help them break down histamine are fractured. And so
Mhm,
I do see that so often with those who have SIBO, who do have intestinal hyperpermeability, who have gut dysbiosis, because we do know also outside of the histamines that are coming environmentally or externally from things like food or environmental chemicals, internally we can produce our own histamine as well.
mhm,
And so it could be certain microbes, whether it's fungi and yeast or other certain bacteria who are histamine liberators, histamine releasers. Adrenaline can cause a histamine release. We do know also estrogen is more of a histamine liberator. So it's so common for those with SIBO, which is in my realm, but I love that you're seeing in your realm and recognizing it because it's such a light bulb moment
mhm,
that so many aren't informed about. And once we bring it to their attention that, hey, this is a histamine symptom. This is maybe mast cell activation, and you should try to get a diagnosis for it. It gives them so much to go off of and so many tweaks that they can make in their lifestyle or other modalities that they can add to their toolbox to help them manage the symptoms until they can really figure out the root cause.
Being integrative gut health registered dietitians for over a decade, we really wanted something. We wanted to formulate something that we didn't have when Dahlia was going through IBS and SIBO symptoms, gas, bloating, constipation, diarrhea, hunched over after every meal. That's why we formulated Gut Nurture. It was a mix of ingredients that we wish we had to pull from all kinds of different supplements in order to make a supplement that actually worked, that helped with motility, that helped lay the foundation to build a healthy gut microbiome. It's safe for kids, it's safe for women. men. It's safe if you have IBS, if you're low FODMAP, low histamine, low sulfur. The list goes on and on. We really made it a ubiquitous, amazing supplement to help your gut thrive, and it is something we wish we had over a decade ago that you have now. Try Gut Nurture, let us know what you think, and be one of the thousands and thousands using Gut Nurture to stay healthy daily.
Right. And what's even crazy about mast cell activation syndrome is that you can have positive rheumatology antibodies when you have mast cell
Mm,
activation syndrome.
Mm.
So there was a paper out there, I can send it to you guys.
I'd love to
Because a
read
lot
it.
of rheumatology patients, or a lot of rheumatologists, we get patients that have positive antibodies and not really fitting the rheumatology diagnosis.
Mm,
And there is a paper out there that shows that mast cell activation syndrome patients can have rheumatology antibodies elevated because
mm,
mast cell activation syndrome is still part of the immune system. So it's stimulating these antibodies to present itself in the body when even though the patient doesn't
mm.
have a autoimmune or rheumatic disease. So that's really interesting. And
Wow.
when you think of mast cell activation syndrome, you got to think about the root cause as well. It's
Mhm,
easy to just give someone Benadryl or chromium sodium to squash the mast cell activation syndrome, but you really got to think about is is it mold that's driving this mast cell? Is it the fragrances? Is it the food? Is it the excipients on the pill itself of the medication that's really
mhm,
driving it? And so it gets even, I mean, you can go down deep rabbit holes with
mhm.
this. With patients that have Lyme disease, mast cell activation syndrome, and mold, those are very hard to
Mm,
treat. It gets very tricky.
And I want to take a second just how epic this is because I mean it's again for doctors, dietitians, health professionals reading the research, you can connect these dots. But just in this conversation, we're connecting these massive dots of like gut symptoms and leakiness of the gut and autoimmune allergies, rheumatology and RA, and I mean all these huge dots that people deal with, and just kind of connecting these dots. And even if I know this is a lot of information for the average person of like mast cell activation syndrome and the the immune system and histamines, and so I know this is a lot. So this is great where later on hopefully you can pause and rewind a little bit, but we have some interesting questions that maybe will kind of help bring it to like real life a little bit. And so we have a question. So what do you do if you're reacting to supplements as well when trying to cure yourself? I've tried everything through functional sorry, went
functional
through functional
medicine. And
medicine.
this
Okay.
person's talking about, it seems like mast cell activation or histamine intolerance.
Interesting.
Where do they start if they're trying different supplements, if their care team is trying to throw things at them and they're just reacting to everything?
Great question. So first of all, we got to find out what the potential root cause is. First of all, you got to test for mold. You got to test for infections as well that could be driving this also, and really make sure it's mast activation syndrome as a
Mhm,
real diagnosis. And if it's a correct diagnosis, and the supplements are like DAO doesn't work, so DAO helps break down the histamine before food. You can take that. If that doesn't work, you're reacting to it. If all the over-the-counter antihistamine supplements, medications don't work, like Claritin, Benadryl, and if you take the quercetin, sticking that on all those supplements don't work, and the medications don't work, then you really got to go to more herbal treatments and medications and start really gentle from there. And then there are treatment options out there that I do in my office, like LDA, or low dose allergen immunotherapy, which is complete alternative medicine,
mm,
LDI as well, which is like a homeopathic treatment that can be very, very gentle, that can maybe start the process of healing for the patient so that they can get strong enough to take on these supplements. And also, you got to think about EMF. EMF
Mm.
also can trigger mast cells as well. So you
mm,
gotta make sure you're not living next to a tower, electric tower. You gotta make sure your home pollution is low. Make sure you get an air filter, clean water source. All these environmental toxins and EMF need to be optimized so that you can begin the healing process. Because the spectrum of patients you can have mast cell activation syndrome patients that just get better with Claritin alone.
mhm,
And then you have a spectrum where they can't even tolerate any of these supplements, these medications. So you got to start very, very gentle and find other alternative therapies.
mhm.
So would it be safe to say when someone is reacting, and I see that, yeah, this went along well, what do you think of herbal antimicrobials for histamine intolerance, such as berberine, oregano oil, and allicin, and probiotics like aspergillosis? What homeopathic medicines have you used? So, A lot of interest in that. Maybe we can start there. Or if either
Well, and you kind of covered it. You talked
we
about
did, yeah.
LDA, LDI as different immunotherapies or homeopathic therapies that you've
Right.
used. But yeah, it seems like this person's asking, are those things appropriate? Because it seems like that's been recommended to them. So, what can people anticipate if maybe SIBO is their root cause for histamine intolerance or mast cell activation? How do you see people tolerate herbal antimicrobials? And can you elaborate on what you're talking about with the capsules? Because we see that so often that maybe they're not tolerating the cellulose capsule itself. So, can you talk about herbs and their place in mast cell activation, histamine intolerance, and their root causes? And then what types of additives and excipients maybe one should look out for?
Yeah, great question. So there are companies that produce more gentle herbs out there, like Beyond Balance, Nutrimedics, that you can use to maybe get patients better first before they can tolerate these supplements. So I use
Mm,
like Beyond Balance for mold, for example,
mm,
and I haven't had patients with mast cell that could not tolerate supplements yet. But those are part of my armory. If or I do LDA or LDI in my office if they
mm.
couldn't tolerate it. So these are procedures. I treat them like medications in my office to get them better. Excipients wise, there's different ones out there. I don't have any on top of my head right now, but excipients are essentially fillers on the medication. So the inside the pill itself is a medication. You may not be reacting to the medication itself. It could be the outer
Mhm.
coating, the capsule itself that you're reacting to. So, so for example, patients can be reacting to Claritin not because of the medication, but because of the pill itself. So sometimes you have to have your doctor order a compounded Claritin, where the pill itself is very clean and it's just the Claritin inside, so you can tolerate it. So everyone's different in that realm. So yeah, I'll let you guys take it from there.
Well, what I tend to see with my very sensitive MCAS, my mast cell activation, or even histamine intolerance people is a lot of the cellulose capsules, right? A lot of these open capsules contain cellulose, and a lot of the times the cellulose is coming from spruce or birch trees. And so, if they have an environmental allergy or if they have an environmental intolerance to some of those things, they might just be reacting to the capsule itself. And, like you said, not even the contents of what's inside, the active ingredients inside of the capsule. So sometimes that will happen, or sometimes they're tablets and yeah, it's mixed within, or any of the other additives to kind of just form the tablet they could be reacting to. So those are always important things to really look into and really understand. Is it whether it's in your medications or your personal care products, is there any additive or stabilizer in there that's causing this reaction? So these are such important things for people to understand. And what do you tend to see? Because I think a lot of people will jump to things like, okay, let me do this huge elimination diet. What are some basic tests that you like to rule out first before jumping into more involved things and looking into mast cell activation? Like, what are basic things that people who come into you with different autoimmune or even MCAS symptoms are you really trying to run?
Right. A great question. So always do the cheapest things first for my patient. So whatever is most cost effective. So I will run labs locally through LabCorp and Quest.
Hmm.
Nothing fancy to begin with. I'll run all my rheumatology autoimmune labs, making sure there's no infections. You can run infection labs, making sure they don't have mycoplasma pneumoniae, no active diseases, no H. pylori in there as a bacteria that can be driving issues. You can even run a basic parasite test on these patients as well. So I run infection labs on my patients, autoimmune labs, especially rheumatology labs,
Hmm.
running, make sure the nutrients are optimized. So you can run micronutrients,
Hmm.
magnesium, RBC, which is, so when you want magnesium, you want red blood cell magnesium because most of your magnesium is in the red blood cell. If you run regular magnesium, you're not going to get an accurate picture, which most doctors
Mm.
run, which regular magnesium. So zinc, copper, you want to run your B vitamin panel. So you do all that. You want to run your hormones as well, like
Mhm.
DHEA, estrogen, run all that. And if you don't really find much there, I go to step number 2, which is root cause testing. So I start
Mm.
looking for mold. I test for mycotoxins. I test the gut microbiome as well, making sure there's no candida overgrowth, no parasites there. Organic acids test will look at the biochemical pathways, will give me further clues whether there's candida overgrowth as well. And on the organic acids test, you can even match it up to the mold test because sometimes I see the mold test being high and the organic acids test also being high as well. So that pairs up really well. And you can see, like I said, the mitochondria health on the organic acids, and you can see whether the patient is having issues with glutathione as well. So there are different brands of companies that do organic acids, but that's one of them. And then there's also I run Lyme disease testing. There's different companies that do Lyme disease. Quest and LabCorp are not accurate for tick-borne illnesses, especially for Lyme disease. It's only 50% accurate at best.
Wow.
It's not accurate because one of the reasons why it's not accurate is because of the way they test it. But number two is back then they were trying to develop a Lyme disease vaccine. So they took out some of these tests that are supposed to do that interactive with the vaccine. Well, the vaccine never got implemented, and these lab companies never fixed that test. So they're missing some of the it's called bands that you're supposed to look for that they don't have anymore. So I go through Igenix. It's out of pocket expensive, but it's well worth it. I've had a couple of patients in the last month where their Quest and LabCorp Lyme disease test was completely negative. I thought they had Lyme disease based on their symptoms and their history. I ran it through Igenix. It was positive for like 3 ticks. So I do that testing, and then there's genomics testing you can do as well, where you can see the SNPs and the genes that might be inefficient that could be causing the patient's issues. So there are a lot of tests. You can even do environmental toxins testing too if you wanted to, but sometimes that doesn't really give me. I mean, it'll tell me the patient has a lot of toxins, but you're gonna do detox anyway. You're giving a lot of supplements already. And then lastly, heavy metals as well. So there's a lot of tests you can do, and you can make $5,000 tests if you want, but I try to do only a couple at a time because I'm trying to keep the cost low for my patient.
Yes, that's so
I
appreciated.
have to shout out the green flag, right? We see red flags with care teams and green. This is a green flag when your provider is going, hey, I want to make sure I'm conservative with testing. I want to do the low hanging, low cost testing and make sure we start there versus these huge packages where you're spending like $3,000 up front on testing. And then only maybe half of it, if you're lucky, actually tells you something about what's going on. Or you're with a provider who doesn't realize, oh, some of these tests aren't even worth it. They're only 50% accurate, and they're just still running all these tests on you. And we see that all the time with patients going, I've spent a fortune, and it hasn't worked out that well.
So we appreciate that. Yes, you're starting with the low-hanging fruits, things that are affordable. You're not requiring this $5,000 package of testing for people coming in. It's evident people are really curious about this topic that we are on today. We have so many questions coming in. We wish we could answer them all. Our time is coming to an end. An hour isn't long enough for us to get all into rheumatology, immunology, microbiome, all the things that we want to talk about, nutrition. So it's evident we'll need to do more of these in the very near future. We know that you have some exciting things coming up and educational opportunities for people to learn from, different things that you're offering and participating in. How can people connect with you if they're not already connected into your system and your resources that you have available? What are things that you have coming up for people who want to participate in learning more about autoimmune, integrative care, functional care, and what are some things that people can continue to learn from you in the near future?
Yeah, so thank you for asking that. So if you want to see me at my clinic, you can go to drlifestyle.org. That's drlifestyle.org, where I treat mast cell activation syndrome, mold toxicity, mycotoxin illness, autoimmune issues of all sorts. Mystery cases that you've seen 10 doctors, I'm probably the best fit for that. I love mystery cases. I've helped quite a few patients. On social media, I'm on YouTube, I'm on Instagram, TikTok, Facebook. That's My Autoimmune MD, MY Autoimmune MD. And I will be starting a podcast soon. I have a autoimmune rheumatoid arthritis summit coming up in May. So stay tuned for that. And just follow me and you'll see some exciting stuff coming out this next year. And you can go to myautoimmunemd.com if you want to get more information on the stuff I do.
And where you're board certified as well, and which states you're certified to practice in. We appreciate that as well, that you recognized, hey, I cannot just be board certified in California. I need to be able to be licensed to work with people all over the country. So you've taken that upon yourself as well to become licensed in more states to practice. So My Autoimmune MD, you can get all of Dr. Yu's information if he's licensed in your state to see you. And if not, you can acquire some of his free resources on on his amazing YouTube channel, on his website, on his social medias. Thank you for just being as passionate as you are, being who you are, being as curious as you are. It is so appreciated, so needed, so inspirational. And we just hope that it helps other physicians really, again, decrease that fear what you don't know and for them to want to know more so it's less of a scary thing. So thanks for chatting with us today. We know that this is part one of many. We look forward to more future chats.
Thank you for having me. It's a pleasure being on your show.
Until next time, you can catch Good Gut Live every Friday live. If not, you're watching or listening on the Good Gut Live podcast, wherever you find podcasts. Thank you so much. As always, feel with each meal
And heal with each meal.
Thank you, everybody.